So good afternoon to everyone. I want to thank Governor Markell for your kind introduction. Thank you, Senator Carper and your team for organizing this event. Thank you, Senator Coombs, Congressman Carney. I wanted to say that you guys are really good. The engagement is just phenomenal. Your knowledge of your subject knowledge and your willingness to be part of what we're trying to do every day and to be supportive just makes all the difference, and I just want to thank you for that. So as many of you know, on June 15th, the Center for Medicare and Medicaid Innovation announced that the Moores will receive $3.6 million as part of a $1.9 billion in cooperative agreements being awarded to 107 organizations from nearly 3,000 applicants, and that's from across the country. This award brings a wonderful opportunity for the Moores to continue our work of advancing the health of children and families in our state. We will do this by launching a new phase of our Optimizing Health Outcomes for Children with Asthma in the Delaware Project, or we call it OHO. We've changed it a few times, but now we call it OHO. OHO will be a kind of continuation of a process we started in 2004 when we broadened the Moores' mission from just a focus on medical care to include health promotion and disease prevention. That led to the official launch of the Moores Health and Prevention Services. And right now, I just want to recognize our Executive Director of the Moores Health and Prevention Services, Mary Kate Mauser. Mary Kate, where are you? There she is right there. I also want to be clear that Mary Kate led the effort in terms of actually getting this grant done. Without her knowledge, support, encouragement, taskmaster, we wouldn't have been successful. So thank you again, Mary Kate. Our goal with this, OHO, will integrate medical care with community-based population health. This linkage will result in a new model of service. We believe a new model of service delivery and health promotion in 3 Delaware communities. We will target this work on Medicaid beneficiaries currently served by our Dover, Seaford, and Jessup Street pediatric practices and the 6 zip codes surrounding these locations, benefiting not only the children we see at the Moores, but also their neighborhoods and surrounding communities, with the aim of reducing asthma-related emergency department visits among pediatric patients in Delaware by 50%. and asthma-related hospitalizations by 50% by 2015. So we've got a lot of work to do. So why asthma, you ask? We decided on asthma because in Delaware, 11% of children are diagnosed with asthma. Only 5 states have a higher percentage of children diagnosed with asthma. So for us, this is a community need that we can help to address, that we need to address. In closing, we are gratified to receive this award that will help us continue our long history of meeting the medical needs of children, but also allow us to meet their non-medical needs, both in the pediatrician's office and in their community, which in turn will allow us to help increase the overall health and well-being of even more children in our great state. At this time, I'd like to introduce Dr. Bill Weintraub. Bill is Christiana Care Health System's Chief of Cardiology and the Director of the Christiana Care Center for Outcomes Research. He is internationally distinguished. He is an internationally distinguished cardiologist and expert in outcomes research. Bill has played many key roles and made numerous contributions in cardiology, outcomes research, and medical informatics. Dr. Weintraub also headed a recent study that was featured in the New England Journal of Medicine. Congratulations, Bill, on that. That's great. And will help pave the way for clinicians to make better decisions for their patients based on comparative effectiveness research. And he'll explain what that means, actually, I hope. So, ladies and gentlemen, Dr. Weintraub.